Ever wondered about the common virus that most parents have never heard of, yet it's a leading cause of hospital visits for children under 1? Imagine a microscopic intruder known as the respiratory syncytial virus, or RSV for short. It's incredibly common, yet surprisingly under the radar. This tiny virus has a huge impact, especially on our little one's health. It's a topic that deserves our attention, and today we're going to give it just that. Stay tuned as we delve into the world of respiratory syncytial virus. RSV, or respiratory syncytial virus, is not as famous as the flu, but it's just as important to understand. This cunning little culprit is responsible for many respiratory infections. It's a lot like that quiet, unassuming character in a mystery novel, often overlooked but capable of causing a significant plot twist. RSV is in fact a common virus that most children have had by the time they're 2 years old. It spreads through droplets in the air when an infected person coughs or sneezes. It can also live on surfaces like doorknobs, toys, and countertops. One touch, then a rub of the eye or nose, and bam! The virus has found a new host. The symptoms of RSV may seem similar to the common cold at first. A runny nose, decrease in appetite, coughing, sneezing, and a fever. However, it can also lead to more severe conditions such as bronchiolitis, an inflammation of the small airways in the lung, and pneumonia, an infection that inflames the air sacs in one or both lungs. Now, you might be thinking, well, we've all had colds, right? But here's the catch. While most of us can recover from a cold or even a mild case of RSV relatively easily, it's a different story for infants and seniors. Their immune systems aren't as robust. For them, RSV can be dangerous, even life-threatening. Infants in particular may experience difficulty breathing and periods of no breathing. On the other hand, seniors might face complications like pneumonia, chronic obstructive pulmonary disease, and heart disorders. While this might sound a bit daunting, the good news is, knowledge is power. By understanding what RSV is, how it's transmitted, and its symptoms, we can better protect ourselves and our loved ones. So, RSV is a common virus that can have serious consequences, especially for our little ones and seniors. But remember, awareness is the first step in the fight against this invisible enemy. How does RSV, this invisible enemy, affect our bodies? Well, respiratory syncytial virus, or RSV, is a common and highly contagious virus that infects the respiratory tract. It's sneaky, often disguising itself as nothing more than a common cold in the beginning. But don't be fooled, it can rapidly escalate and wreak havoc, especially in young children and the elderly. When RSV enters your body, it starts its invasion by attaching itself to the lining of your nose or throat. Here's where things start to get interesting. The virus begins to multiply and spread, infecting the cells in your respiratory tract. It's a stealthy adversary, often going undetected until it's already made a home in your lungs and bronchial tubes. Now, our bodies are pretty amazing, right? They're designed to fight off such invasions. So as soon as it detects the virus, your immune system swings into action. It sends out a team of white blood cells, the body's little soldiers, to combat the virus. These cells release chemicals to fight off the RSV. But this battle is what causes inflammation and swelling in the airways, leading to symptoms like coughing, sneezing, and difficulty breathing. But why is RSV particularly severe in infants and the elderly? Well, in infants, their immune systems are still developing, making it harder for them to fight off the virus. Plus, their airways are smaller, so any inflammation can lead to severe respiratory problems. On the other hand, the elderly might have weakened immune systems or underlying health conditions, making it harder for them to combat the virus. RSV isn't just a tiny, invisible enemy. It's an invader launching a full-scale attack on our bodies. It's a master of disguise, often hiding behind the mask of a common cold. But once it takes hold, it can cause a significant disruption in our bodies, particularly among our most vulnerable, the young and the old. As you can see, this tiny virus can cause quite a disruption in our bodies. Now that we know what RSV is and how it affects us, what can we do to prevent it? Let's begin by acknowledging that prevention truly is better than cure. And with RSV, this adage rings particularly true, as there is currently no specific treatment for this virus. So, how can we arm ourselves against this invisible enemy? Firstly, good hygiene practices are our primary line of defense. Regular hand washing, especially before eating and after visiting public places, can significantly reduce the risk of RSV transmission. Using hand sanitizers when soap and water are not available can also be helpful. Moreover, teaching our children the importance of cleanliness and good hygiene can go a long way in preventing not only RSV, but also a host of other infections. Avoiding contact with sick individuals is another preventive measure. If someone is coughing or sneezing, it's best to maintain some distance. It may seem like an overreaction, but remember, RSV is highly contagious and can easily spread through droplets in the air. But what about those who are most at risk? High-risk individuals such as infants, the elderly, and those with compromised immune systems need additional protection. If you're sick, avoid close contact with them. If you're healthy, ensure their environment is clean and free from possible sources of infection. Now let's talk about the future. There is ongoing research for the development of RSV vaccines. Although none are currently available, the strides made in this area are promising. With continued research and trials, we might soon have a vaccine that can protect us from this virus. In conclusion, while it's impossible to completely eliminate the risk of RSV, we can significantly reduce it by adopting good hygiene practices, avoiding contact with infected individuals, and ensuring the safety of high-risk individuals. With these preventive measures, we can reduce the risk of RSV infection and protect our loved ones. In the unfortunate event that RSV strikes, how do we fight back? This is where our resilience comes into play, and we start our battle against this microscopic foe. The first line of defense is something as simple as hydration. RSV, like many other viruses, can cause dehydration, and maintaining fluid balance is crucial. So sipping on water, juice, or broth can help keep the body's hydration levels in check. It's basic, but incredibly effective. Next up, rest. Giving the body time to recuperate is key. RSV can make you feel worn out and fatigued. Therefore, taking it easy, getting plenty of sleep, and allowing the body to use its energy to fight off the virus can make a significant difference in the recovery process. But what if hydration and rest aren't enough? That's when medical intervention becomes necessary. Depending on the severity of the symptoms, doctors may prescribe medications such as bronchodilators to help ease breathing, or in some severe cases, hospitalization for oxygen therapy or intravenous fluids might be required. Remember, every individual is unique, and so is their response to RSV. Therefore, the treatment plan may vary from person to person, but one common factor remains: the importance of early detection. Recognizing the symptoms of RSV at an early stage can help in seeking timely medical attention. This not only improves the chances of a swift recovery, but also helps prevent the spread of the virus to others. And let's not forget about our smallest warriors, the infants. For them, early detection and treatment are even more vital. Specialized care, such as using a suction bulb to clear their nasal passages, can help them breathe easier. This is not a battle we should fight alone. Always consult with healthcare professionals who can guide us through the process with their expertise. In the end, the fight against RSV is not just about treating it. It's about understanding it, recognizing it, and taking proactive measures. With the right tools and information at our disposal, we can ensure a swift and efficient counterattack. Armed with knowledge and timely action, we can tackle RSV effectively. Let's continue this fight, not with fear, but with understanding and preparedness. Let's quickly recap what we've learned today about respiratory syncytial virus. RSV, as we've come to know it, is a common yet potentially serious virus that primarily affects the respiratory tract. It's invisible to the naked eye, but its effects, especially on infants and the elderly, can be quite visible and severe. We've delved into how this virus invades our bodies, setting up camp in our respiratory tract, leading to symptoms that can range from a common cold to more serious conditions such as pneumonia or bronchiolitis. It's a silent infiltrator, making its presence known only when it has already begun its attack. But we've also highlighted that prevention is better than cure. Simple habits like regular hand washing, avoiding close contact with infected individuals, and keeping our surroundings clean can go a long way in preventing an RSV infection. And let's not forget the battle against RSV. We've learned about the various treatment options, from over-the-counter medications for mild symptoms to hospital care for more severe cases. Vaccines are also in development, offering hope for future prevention. In the end, it's about being informed. Recognizing the signs, understanding the preventive measures, and knowing when to seek medical help can make a significant difference. Remember, knowledge is power. Stay informed, stay safe, and take care of each other. Thank you for joining us today.